Welcome to the Urgo Medical podcast series, titled Beyond the Wound, your source of leading voices for healing people. We are your hosts, Cassandra Huff and Tanya O'Hara, both clinical specialists with Urgo Medical. We are so excited to have you join us as we chat with clinical experts and bring you on-demand educational and informative content as we discuss future directions in the prevention and best management of people with wounds. We all know that some wounds are hard to heal and can pose challenges for both patients and clinicians. At Urgo Medical, our mission is healing people so that life can begin again for patients and their families. We aim to work in partnership with healthcare professionals to help improve patient outcomes and make a difference in their lives. To give you some background about Urgo Medical, we originate in France in the wine-growing region of Burgundy. And Urgo Medical is the advanced wound care division of the Urgo Group. Although our history dates back to 1880, Urgo Medical was only established in the year 2000, with the introduction of the first advanced wound care dressing, Urgo. Urgo Medical is present in 17 countries, including Australia, since 2019. Our head office is based in Cremorne, Victoria, and we now have grown to 16 staff across the country who are passionate about healing people. As a group, Urgo is committed to research and development and invest more than 33 million euros each year, or 53.6 million Australian dollars, in innovation, research and development of our technology and products.
Here in Australia, we have achieved so much in the 3 short years since inception, and we are proud of a number of milestones and collaborations, including the Safe Feet, Save Lives initiative, a worldwide diabetic foot program to support clinicians and patients to close wounds, save feet, and save lives. This program focuses on diagnosis, education, and materials to help identify a diabetic foot wound and provide clarity regarding the referral pathway from primary care to hospital.
Our ongoing partnerships with organisations including Wounds Australia, the peak body for wound prevention and management, and Diabetes Feet Australia, the peak national and clinical research body for the diabetes-related foot health and disease.
A commitment to providing evidence-based technology seen with the inclusion of sucrose octasulfate impregnated dressings, otherwise known as Urgo Start, in the 2021 Diabetes Feet Australia guidelines.
The successful launch of Urgo Start Plus in 2022, which is an addition to the Urgo Start family and provides a simple, effective and reliable solution for local wound treatments in all stages of healing from day one until complete closure.
The inclusion of our products on the Repatriation Pharmaceutical Benefit Scheme, or RPBS, to provide affordable and efficacious wound care to the Department of Veteran Affairs patients.
And our support of Australian clinicians through the Urgo Foundation with the APAC Diabetes Foot Disease Grants. These grants provide support for innovative practical projects that aim in improving diabetes foot ulcer prevention and management in the APAC region. In the last 3 years, the grant has been awarded to Australian clinicians each year in support of their projects.
Now, we are happy to be working with some wonderful people in the wound care space in the launch of our inaugural podcast series that we are very excited to share with you. The aim of these podcasts is to inspire you to become wound ambassadors and future leaders in the prevention and treatment of people living with wounds. So join us during your morning walk, in the car, while you're preparing dinner or during your work break, and learn from some of these amazing clinicians, healthcare leaders, researchers, and even patients that have something to share about their journey in wound prevention and care. Additionally, please let us know if there are specific topics you would like to hear more about in our future series of Beyond the Wound, your source of leading voices for healing people.
But what about when the skin, the largest organ on the body, what happens when that fails? When do we start looking at that as a health priority?
Welcome to Beyond the Wound, your source of leading voices for healing people. My name is Tanya O'Hara, and you are just listening to Hayley Ryan, our guest for today's episode. Hayley is a wound clinical nurse consultant with over 17 years' experience working across both Australia and New Zealand. Hayley currently works as the Wound CNC at Uniting Aged Care and is also the Director of WoundRescue. She holds the position of Wounds Australia Board of Directors. Hayley has presented at national conferences and has a proven track record of providing advanced wound care education. Okay, Hayley, before we begin, let's talk terminology as it seems to be changing. The term hard to heal wound is a wound that we know that fails to heal in a timely manner with standard therapy and can be used to replace the term chronic wound. Although these terms both, encompass all wounds that are stalled or delayed. Can you talk me through this?
Yeah, look, it's a new term coming through, hard to heal wounds. We used to focus so much on what a chronic wound was and how it failed to went through those processes of healing. And we now realise after many, many years that hard to heal wounds not only encompass chronic wounds, but also acute wounds and also complex wounds. Basically, any wound that is failing to heal in a timely manner. And there's a varied factors that cause this, chronic illness, poor blood circulation, infection, even down to inadequate nutrition. So we're starting to recognise hard to heal as the new terminology.
And we know that the presence of a wound, and more specifically a chronic wound or a hard to heal wound, represents a considerable burden, in terms of economic cost to health and social care providers, as well as negatively impacts the health-related quality of life of patients who live with these wounds. And it really is a silent epidemic here in Australia. So what does this burden actually mean for governments, patients and their families, and also the clinicians that deal with these wounds and manage them on a daily basis?
Here's what the statistics tell us. There's around 450,000 people living with a wound at any one time in Australia. And that's a very conservative number because we don't have real databases to collect this information. So that's the most we know at this stage. We know that it costs the health expenditure around $3 billion a year. You mentioned quality of life, and wounds can cause significant pain, discomfort, even physical limitations to the person. So their overall health, their overall well-being, even their mental health can absolutely be factored as an issue. I read some statistics just this morning around the Australian Bureau of Statistics, and what they've said that particularly for our ageing population, in 2021, around 16% of the population was aged over 65 years. Now, why is that statistic important? Because they're more likely to have other issues, peripheral vascular disease, impaired mobility. We are an ageing population. So we're starting to see higher rates, particularly in those over 65 presenting to hospital, needing more treatment. We now see that there's an estimated 50% infection rate. So we've got a major issue on our hands.
Yeah, these are really quite frightening statistics, aren't they, Hayley? And as you mentioned, the burden of these chronic wounds is really expected to increase in the coming years. So why is it, Hayley, from your perspective, that wound management receives little attention compared to other chronic conditions?
There's certain barriers to implementation of evidence-based wound care. It's high cost to treat, it's high cost to prevent, there is inadequate reimbursement for wound services and products, and there's poor education. So what we talk about is early referral. We want to spread the message, get the awareness out there. Educate and training must occur, but also recognising wound care as a specialty in its own right. We really need to start looking at it as a health priority. It's why we do a lot of reform and advocacy work with our government, and we are really trying to reshape what wound care looks like. We focus so heavily on the heart as an organ, the lungs as an organ, and if they fail, we say it's a respiratory condition or a cardiac problem. But what about when the skin, the largest organ on the body, what happens when that fails? When do we start looking at that as a health priority?
Yeah, absolutely. Seems like there's a lot of work to still be done, but that there is definitely some momentum there. What are some of the other sort of effective solutions, I guess, that you think that, would be pertinent to helping overcome these barriers?
Well, first and foremost, widespread advocacy. We really need to demonstrate to government bodies that there is net financial savings to be made, and they just need to invest in more resources, innovation, state-of-the-art wound management. We need to look at better clinical pathways. How do we partner with industries such as yourself to do that? We need to focus on lobbying the government and health insurance companies. How can we get reimbursement for those living with a wound? We need to, I said already, training and education. I'm not just talking about training for clinicians, but what about for the person living with a wound? How can they start to, one, prevent the wound from happening in the first place by good skincare, but two, if they do get a wound, how can they be involved in that care? And that will, I believe, start to change concordance rates. We know that sometimes, particularly those living with a venous ulcer, that their wounds can be quite delayed with healing because they don't have the appropriate treatment. In that case, that would be your compression bandaging. And sometimes that's due to the fact that there's just non-concordance. The patient's uncomfortable. They might live in the tropical climate of Queensland, for example. They don't want to be wearing something that's going to make them hot. So what do we need to do differently? So that comes down to increasing awareness, and that is via government, universities, other educational institutions, and the consumers themselves.
In terms of strategic objective with government, is there any progress in having these reimbursements and rebates?
Over the last few years, we're starting to get momentum. And that is largely from the back end of the Wounds Australia 11-point plan, which has really developed a framework for improving wound management and getting it as a reform piece to talk to Parliament about, making it that health priority that I spoke about. Now, in 2019, Wounds Australia also released a position statement calling for wound management to be recognised as that health priority, but also increasing the need for investment to provide better research in Australia and education. The sad fact is, Tanya, we currently have to look to our global partners for current statistics, for current research. Why are we not doing that in Australia? I'll never understand. And how do we start to talk to those private health insurance companies? How do we get consumables subsidised? There are still significant gaps that we need to work on, and particularly I want to just call out rural and remote parts of Australia. If we're talking about equity care for all Australians, we have to factor in everybody who lives here.
Absolutely. And you mentioned the 11-point plan, which I think is an amazing initiative that I know you're quite involved with. Can you share a little bit more with us around that and how it's been received by our government?
Sure. So it was very clear we want a national wound strategy. We will continue to partner with the government to drive that initiative. We do a huge focus every year through our wound awareness campaign, which we really meet with state level politicians to federal politicians, and we've certainly gained momentum in the last few years. We want to see increased investment in wound research. That's certainly in the 11-point plan. Obviously education and training, and improving that access to consumable schemes. We are hoping in the very, very near future that we will have some fantastic announcements to make to those living with a wound in Australia and clinicians that treat them.
Wow, that's fantastic news. Can't wait to hear more about that as it comes to fruition. Can you share a little bit about, I guess, the stigma that might be also associated with patients living with these chronic wounds?
Great question, Tanya. There's a huge stigma. Okay, so there's people out there living with these wounds that are staying isolated. The reason they're staying isolated because they don't want to go down to their local shop with a smelly, stinky wound that may leak through that dressing if it's not the appropriate dressing. There's that horrible stigma also within the community that, if they're an older person, it's expected they'll get a wound. These are things that really hold dear to my heart because we need to change that stigma. And how we can do that is by providing that educational support. We don't start with the basics of this is not a thing to be concerned about. This is normal. We need to get people out living their life. The amount of times I have heard my patients say, I can't go to work anymore. And I'm talking about 30-year-olds. 35-year-olds, 40-year-olds. I'm not talking about the 70, 80-year-olds. These are young, mid-aged people that want to go and contribute to the workforce and can't because they're living with a wound.
I think we definitely agree that, the needs of the patient remains paramount, and that evidence-based wound care and cost-effective wound care, as we've discussed today, does indeed improve patient outcomes. And we need these changes to policy that you've discussed and the funding structures in place, as well as these high-level investments in wound care and policy development to really drive home and improve the affordability and support access to health professionals and multidisciplinary teams, and first and foremost, also these patients.
Absolutely, Tanya. And look, I'll just add one more element there. And this is a call to duty for all managers listening in today. If you are thinking about using cheaper products, that is going to reduce the quality of life for that person because they're going to have that wound for a lot longer. And if you actually look at the statistics, by the time you pay the clinician to continue to do that dressing regime, you're actually going to be, in the long run, a lot worse off. So think about your advanced products, not for everybody, but for some, but get a specialist in to help guide you.
Yeah, absolutely. Ultimately, our goal is to close these wounds sooner. So, Hayley, you mentioned inequity, I guess, in rural and remote areas specifically. And I guess when we consider rural and remote areas, we do need to also consider things like our First Nation people. Do you want to expand a little bit more, I guess, on the burden for First Nation people?
Absolutely. Again, very dear to my heart. I am an proud Aboriginal woman from the Wadi Wadi people, and there's certain disparities. Access is one, particularly if they are in rural or remote, but First Nations people also have a high prevalence of diabetes. And what we know in Australia, that it's estimated around 4,400 diabetes-related amputations occur every year. That's a huge statistic. That's one that we need to change. That's something that must change. If we are talking about amputating limbs, we need to start thinking about what we need to do better. So when it comes to our First Nations people, what other programs can we invest in? And I guess this is a call to our government bodies that may be listening in. What can we do better? What can we do different? Let's stop talking about what's been done, what we're going to do, and let's start doing it.
Absolutely. Thanks, Hayley. Can you expand a little bit more around the social and psychological and physical burdens that these patients endure that are living with these chronic wounds?
Yeah, it's another great question. We know that people's mental health really, really gets impacted if they're living with chronic wounds that are not healing. It impacts their entire life, their entire existence. We have seen suicidal ideation increase in these cohort of people that are living with a wound. So if we've now managed to heal a wound, we've got somebody who's already impacted by fatigue and exhaustion of having a wound, it may reoccur 70% of the time in those within the first year. We're talking about the whole person holistically. Are they eating well? Are they drinking enough fluid for the fluid that's coming out of them? Are we actually thinking about their mental health, providing mindfulness activities when they're stuck in a certain area? How do we get them through or out of this horrible disease process?
Absolutely. And yeah, you've highlighted many of those. And as clinicians, we know that managing these wounds is really complex. And as you mentioned, it's not just about the wound specifically, it's beyond that. And, there is a big need to look at the patient holistically and look at what we're doing and reflect on our practices and pathways and access and all of the things that you have mentioned today to ultimately improve the quality of life and healing rates for these patients suffering with these chronic wounds.
Yeah. And look, there's things that you can do. If you're listening today, the first thing I would urge you to do is contact Wounds Australia. Very small fee. I'm not trying to give them a plug today, or maybe I am, but getting involved helps Wounds Australia lobby to the government. If you are somebody who either lives with a wound or you are actually assisting as a clinician to heal a wound, you have the need and the want to help them. To do that, help Wounds Australia drive this initiative. In fact, Wounds Australia has a campaign at the moment called the Wound Army. Join that Wound Army and become an advocate for change. If you are requiring any assistance, your industry partners are always there to help. We've got Tanya on the line today and her team who have done a fabulous job in trying to close the gap. And of course, there's my company, WoundRescue, where we do provide education and training and referral pathways. There are also other local specialists, wound specialists I'm talking about, who are available in your area. Become friends with them because they're going to help you and your patients get better quicker.
Thanks so much, Hayley. So of the things that we have discussed, what would one take-home message be, I guess, for the clinicians listening today?
Wow, what a great question. And before I answer that, Tanya, I am just going to briefly talk quickly about the AMA's report, the Solutions to the Chronic Problem in Australia. And the reason I want to raise that is because it's very clear in that AMA report about the need for MBS items and how we can better subsidise clinicians to provide that care. And what they did so delicately and wonderfully in this is they talked about that consumables scheme, and they based it off, if you have to pay for this with a consumable scheme, here's what it costs already to place people in that hospital system. If you put this program in place for a consumable scheme, you will save around $50 million per year. Now, that's in writing. It will also save a GP practice around 162,000 consultations yearly. We know our GPs are stretched. How do we start collaborating to work better? Now, the reason I answered that first, Tanya, is because it's the collaboration that I want to talk about. How do we do wound care better? We need to collaborate, and that is with industry, that is with peak bodies like Wounds Australia, that is with the consumer themselves. And you asked me what is one thing that I would leave everybody with today. My tip is very simple. If you have a wound, you need to engage with local wound specialists early. The quicker you refer early, the quicker you're going to get rid of that horrible wound. So if you've got a wound, get it checked out.
Hayley, thanks so much for joining us today. It's a pleasure to have you join me.
Thanks so much for the invitation. You know, I always want to get wound care on the map, and you're helping us do that. So thank you for the invitation.
Chronic wounds really are a significant problem here in Australia and can have a significant impact on the health-related quality of life of the affected individuals. And despite the significant impact they have on the healthcare system and the economy, chronic wounds remain an under-recognised and underfunded public health issue. And as Hayley highlighted, there are solutions that can be implemented to minimise treatment costs, which currently costs the healthcare system $3 billion per annum here in Australia. And managing chronic wounds is certainly very challenging and complex for wound care specialists. There is a significant potential for improved patient outcomes through the delivery of evidence-based care, improved education for clinicians, which will ultimately allow for effective treatment and prevention of wound care complications. Hayley also highlighted the need for better use of clinical pathways, improved communication, and reliable service providers. And I agree that recognising wound care in its own right and recognising wound care as a health priority, along with providing the support and the resources to ensure all patients receive equitable care here in Australia, should be paramount. And I hope you enjoyed listening along with us. We have links in the podcast description for those listeners who want to go further beyond. Whether you want to learn more about Hayley and her work or learn more about the topics we discussed. If you enjoyed today's podcast, we have more episodes coming soon, featuring Australia's experts in the chronic wound space. Make sure you save us so you're reminded when we drop the next episode. Here's a sneak peek of our next episode. See you next time.
I actually really don't like the word wound management. I don't like to describe myself as somebody who does wound management because it puts the emphasis in the wrong place. We actually care for people who live with and experience wounds, and that means that it must be an all-of-person response.